Yeah, I think we could start it now. It's absolutely
Yes.
9 a.m. and we are also on live stream right now. We have 1 hour of time to, it will allow us to 1 hour to record it. So,
Okay.
around, yeah.
Yeah. Thank you, Santosh. Thank you. Good morning, everyone. I thank this platform, the Innovative Alliance for Public Health, for providing us this opportunity and celebrate International Women's Day 2023. We have gathered here. This is the first of the series of the webinar wherein we are celebrating our successful women nurses and their achievement. So, this is the first series, and we have here with us a very dynamic personality, my dear friend, and uh, we are. Associated in many platforms, and I love her for what she does. And Mrs. Jeena Pradeep, she is a senior nursing officer, but currently deputed in the ministry. We'll come to know that later on in due course of this webinar. So I welcome each one of you, and we'll be hearing Jeena in detail about her journey as a nurse, as a person. So, the very objective of this series is to disseminate informations to our fellow nurses uh, of the available support system and related challenges wherein Gina has traveled through. So, Gina, very good morning and once again welcome to this platform.
Good
And
morning, Dalma.
yeah, yeah, and a very, very happy International Women's Day.
Thank you. Same to you. Same to
Yeah.
you all.
Yeah, so Gina, first I would like you to introduce yourself as a Gina, the person, not the nurse. Yeah, a little bit about your childhood, your schooling, and then we'll come to later on as a Gina, as a nurse. Over to you, Gina.
Thank you, Dolma, for that such nice introduction. Uh, my childhood, I am basically from Kerala, and my schooling was done till 12th in Kerala only. After that, I came to Delhi for giving an entrance examination for nursing at Lady Harding Medical College. Luckily, I got into that, and I did my diploma from Lady Harding Medical College in nursing in the year 1993. And immediately after completing my training, I joined at Lady Harding Hospital only. I got into a government job that was also very fortunate. At the age of 21, I got into the government job. Those days were like, it was not very difficult to get a government job in those days. So there is a associated hospital named Kalavati Saran Children's Hospital. That is a pediatric section and exclusively for pediatric population associated with Lady Harding Medical College administration. So I did my nursing training from Lady Harding, and I joined as a nurse, staff nurse. Those days it was called staff nurse, the profile. And now it has been almost 30 years since I got into that job or as a nursing officer. Now the nomenclature has changed since 2014. So that is nursing officer. And my family includes my husband and my 2 kids. They were with me, but nowadays they have shifted to some other states for their education purpose. So my husband is an ex-Air Force, Indian Air Force personnel. Now he is doing some private job after retirement. My kid's eldest one is my daughter who is completed her 14th year, and my son his aerospace engineering, and he's in second year, and he's doing his aerospace engineering from Coimbatore, Amrita University. So that's all
Yeah.
about my family. And my childhood was
Thank you so
in
much,
Kerala.
Gina. The very reason
Yeah.
why I asked you about is you are also a normal woman, a lady who is running her home, family as well as workplace. So, to the audience, I would like to say that with a family, a full family with children, husband, and children's education, everything, you can also achieve success in your career. That is the you just need to have balance between your career and family. So that's the only reason why I asked about your family, Gina. So just brief about your further education, because you said you have done your GNM from Lady Harding. So we have one thing common again. We both are from Lady Harding. We have done our general nursing from Lady Harding. So this is one common thing about us. So
Yeah.
about your further education.
Okay. So, while talking about my further education, as I said, I came to Delhi after completing my 12th, and I joined for a diploma program from LHMC. Immediately after training, as I said, I got appointed as a staff nurse at Kalavadi Saran Children's Hospital, and almost spending, um, I think, 5 to 6 years, I realized that my knowledge on the nursing domain is insufficient. Somewhere I feel that I have some limitations in performing my career in a better way, because I got trained from a government hospital and I got into practice in the same hospital. But many times I felt that my knowledge is not sufficient, my competency and skills are not adequate, and attitude also. Sometimes I'm in dilemma deciding in decision making, because the working environment is very challenging. I do not know how many of you understand about the public sector of our healthcare system. Hospitals like us are having, I don't know, I'm the right person to tell here, because I'm a little bit concerned about my position right now. But let us, we are only four, no? So, in hospitals like ours, having one bed has 3 to 4 patients at any point of time. So, uh, you know, ideally, the patient bed area should be 100 square feet minimum for a patient. But patients in our settings are only getting 13 to 15 square feet for their care. And as nurses, we find it very difficult to start all the infusions, because one child admitted in a hospital for treatment means 4 to 5 infusions 3 times a day, at least 2 times a day, frequent nebulizations, and so many nursing tasks you are supposed to complete. But considering the workload and high case load, we are only able to perform one or two, maybe 3 or 4 tasks, which is very essential for them. As a result, we are only giving maybe injection administration, IV fluids, feeding every 2 hourly for the neonates and the pediatric population it is required. So we end up doing only 3 to 4 tasks in our career. But when I find it is very difficult to perform according to my conscience, what I learned, and in a setting like private sector, it was difficult. Then I decided to go for my graduation.
Mm.
So I explored. Then I found out that AIMS New Delhi is also providing post basic nursing course. I applied for first time. I got rejected. I remember the days when I uh, went for interview, the question which I had not answered was, what is the unit of injection tetanus toxoid, and I was not aware of the answer. So maybe that is why first time I got rejected from admission, but the second time when I attended interview, I was sure with that answer, what is the unit of injection tetanus toxoid. So it was like Loeffler's unit. I still remember, but that question was not asked during the second time interview. Anyway, what I was telling that in the second attempt, I managed to get an admission into post basic uh, degree course. So I completed my post basic BSc nursing from AIMS New Delhi in the year 2006. Then I came back to my parent institute and I realized that I still have a leadership role in me, but I am not able to do that because of the environment, the system, how the system is working in public health sector. I'm not blaming the system. Why? Because in a public hospital like ours, we need only diploma nurses for the nursing care, for the essential tasks we are carrying out. Diploma is only the requirement. So they do not promote any further education. If you are doing it, it is for your satisfaction and not for the hospital, because the higher qualification and leadership is kind of neglected area in the public sector. But in order to satisfy my desire, I thought of taking doing masters. Then my kids were very small, but in the year 2011, I got into MSc master's program from Jamia Hamdard. So I completed my master's in child health nursing in the year 2013, and I came. That was done in loss of pay because I have already availed my 2 years of with pay leave for the study purpose for doing BSc post basic BSc nursing. And doing this master's without salary, it was really difficult for me, and my family supported me by sending monthly expenses. So it was really a time when I struggled a lot with financial problems. You can understand that as a nurse, how can we live without salary for 2 year period? Anyway, uh, everything is over now. So in the year 2013, I completed my masters. Then I came back to my parent institute, and I thought of doing PhD in the year 2019. So I got into PhD program from Amity University. So there was an entrance examination for the same, and I never thought I would get into that. But after I do the enrollment in PhD program, that was another thing. When I think of, I really feel very happy about it. So currently, I have completed my masters, and this is the uh, yeah. So in December, by December, I am supposed to complete my MOHFW. And for the other side, after 18 years in the position of nursing officer, I got promoted to senior nursing officer. After first promotion happened after 18 years of my career, right? So in senior nursing officer also, the responsibilities are same like nursing officer for a public health sector like ours. You have some other responsibilities like intending medicines, inventory of stock, and maintenance equipments, like that. Otherwise, 80% of your job responsibility is with like nursing officer only. So for almost 30 years, I was like bedside nurse. Very recently, on 1st of February, I joined 2023. I joined at DGHS as Deputy Assistant Director General. So I would like to tell you that for the desire of satisfying myself, I did my BSc, I did my masters, and I kept myself equipped. And when the time came, I applied for the post, and I never thought I will get into this position,
Okay.
being a clinical
Yeah.
bedside nurse. But
Gina will come
that
to that.
also happened.
Yeah, we'll come to
Yeah.
that later on. So
Okay.
first, in your clinical experience, you have we know that you have a very long years of experience in clinical, as well as you have been doing a very good in CNE cell as well. So you have been involved in the CNE cell as well of the Kalavati Hospital. So do you have any particular experience which you want to share, or any challenges as CNE coordinators face in a public health sector?
Okay. So, training, refresher training was actually not happening in the clinical side of a public health system, public higher delivery system. But in the year 2016, Government of India has decided to start with continuing nursing education programs. So that was a good news for all of us. They are funding for a 7 days workshop for every hospital, any hospital in India. I think for government sector, private sector, corporate sector, I don't know, you can explore on that. But government has a provision of having having an adequate amount of money for TADA, honorarium for speakers, refreshments. So all of you can explore and utilize that provision. You need to approach the government DGHS or Ministry of Health and Ministry of Health and Family Welfare section of Nirman Bhavan. So we also got a message from MOH and Family Welfare to start with CNE. So that was really a very good news for us. We MSc nurses, some of the MSc nurses uh, took initiative, opened an account, received money from MOHFW, and started with CNE cell. And once we completed the CNE cell formation formalities, we could conduct 20 workshops, almost 20 workshops we have completed since 2016. Meanwhile, COVID has come. There was a halt for conducting the CNE activities for 2 years, but still we were able to finish 20 such nursing workshops for our clinical nurses. Sometimes we invite 5 to 6 nursing personnel from the nearby hospitals, that is from RML, Safdarjung and Lady Harding Hospital. Otherwise, we spare the nurses from our hospital only, and we update with our nursing skills, which are dedicatedly required for a pediatric population. So that was a very good thing, for in which we were able to update the skills of pediatric competencies, right? What we require, we were doing it all the time, but not up to the mark. So we could improve the technical skills, we could improve the knowledge, and even the attitude of the nurses have changed a lot after the CNE. Challenges, the only challenge we faced was sparing nurses. 30 nurses from the clinical area was really difficult. Otherwise, it was smooth, and we have a good experience from having this CNA.
Okay.
If we talk about infrastructural challenges are there, but considering our Kalavadiswaran Children's Hospital is a very small hospital, we don't have much infrastructural provisions. It's a small building. It's a 395 bedded hospital. We don't have space for the hospital. We don't have space for the patients. then I'm not complaining about, say, any rooms provisions, so like that. So I don't think that is a really going to be a challenge. It's a challenge, we don't have the infrastructure, but we can manage, and we could manage 20 workshops. Yeah.
Okay. So, since you are saying that challenge is not a challenge, I know you are into quality improvement, and we have been there since now many years. We have been together as a quality improver in the healthcare system. So I would like to, you to sensitize people what quality improvement in healthcare is in short, very short, because I know you can speak for whole day if I allow you to speak about quality improvement. So I just wanted you to just brief them what quality improvement in healthcare is, and how we as a nurses can contribute, and why we should involve in quality improvement. Yeah, Gina.
Okay. So that was that was another story. I got into quality improvement by chance. I never thought of getting into quality. Once hospital, and a doctor from an ICU and some nurses were supposed to attend that meeting. Then we went to the seminar room. We sat there for some time, and the meeting not finished before 4 o'clock. So some of them went away without attending the full meeting. But I did not feel like getting up and go after my duty hours. I kept sitting there till 5 o'clock. That meeting on the first day continued till 5 o'clock. And we had further meetings in which I attended those meetings fully and got introduced into the quality improvement concept. There were other nurses with me, but all of them uh, partially attended these meetings because their duty hours were till 3 o'clock. After duty hours, they had their own commitments, family commitments. So all of them went without fully attending these meetings. So because of my personal this thing, I kept sitting and attended those meetings fully, and gradually I got into this quality improvement. I understood the simple methodology, and I thought this is the best way to improve our processes in a public healthcare delivery system. We are doing everything, but we are lacking the ideal processes. We don't have such protocols, SOPs. We are not carrying out any nursing process in an ideal manner. So this is the methodology where we can improve one by one gradually. So I thought this is, I got interested into quality improvement, and I started taking small sessions. After so many workshops, I did not understand anything about quality improvement in the first workshop. I attended multiple workshops. Then I understood the exact methodology, how a process is going to be improved using this simple methodology. So it took me almost 2 years to be a quality improvement faculty as a resource person. So I, by the time we like-minded doctors and nurses formed an organization which is now known as Nationwide Quality of Care Network. That is NQOC, NQOCN. You can Google it and you can visit that website. And along with NQOCN, we go to different states, different district hospital facilities, different health and wellness centers, PHCs, for mentoring nurses. So the clinical nurses can mentor the other nurses who are working in the rural areas. And that was a very good experience for me. I go to see the J Park book. In nursing we have learned from J.E. Park book, and the system is how beautifully designed the Indian healthcare delivery system. I could appreciate that, because the last, I would say, I have met the last beneficiary of our health system. So we are going to the door of that healthcare worker who are working in the health and wellness centers. Now, all the sub centers are now being called health and wellness centers. You know that, no? So, in health and wellness centers, nursing officers are working as middle level healthcare providers or CHOs, community health officers. And I think that is the best thing happened to the nursing profession. And you see, the health and wellness center is a branded building, and the first floor of this health and wellness centers are for these CHOs. There are other CHOs also, like one CHO can be a nurse, a homeopathic Ayush doctor also can be a CHO. But when I see a nurse functioning as a CHO, it is very exciting, very interesting for me. And yeah, what I was talking about is entry into the quality improvement made me like worth being a nurse.
So why do you think other nurses should take interest in quality improvement?
Yeah, nursing, nurses are the largest workforce in any healthcare system. You understand that, no? So, until unless you convince a nurse in the setting wherever you are working, quality is not achievable. No matter the highest administration will try for the quality assurance accreditation program, but I would say if you convince the nurses, being the largest workforce in the health system, if they are convinced, if they are motivated, if they are provided with right kind of infrastructure, consumables, and right environment, they are the best persons to be the best, providing the best quality to the patients. So
Mm,
the nursing process needs to be changed first. Nursing audit has to be taken first before we go for accreditation.
mm. I
Uh,
think, yeah.
yeah,
Uh,
so nurses should come into the quality efforts.
Yeah. So I agree with Jena. Through many years of experience, I think we nurses have lots to contribute in improving the quality of the services in the hospitals. Three things which Jena said I would like to highlight in the previous question. What Jena said was when she was introduced into quality improvement, the meetings which were officially arranged, many of her colleagues went after the office timing was over. So I also had this experience that when I was introduced into quality improvement, the meeting always used to be on Saturdays at 4 o'clock. Imagine my duty is up to 1 p.m. and then I have to wait till 4 p.m. and then attend the meetings. So many people they do not attend meetings, you know. But I do had interest, just like Gina said that she was interested in the first meeting itself. I also was, attracted to this quality improvement concept, and then I gave my own time. She said she has also given her own time. So this is very important for us nurses to at least invest something. Invest something means invest your time in developing yourself as a healthcare provider, you know. So this is one thing, because we have seen that just office timing is over, then like nobody takes interest. This is not like it. I would request everyone to at least invest your own time if you want to do something extra. And
Yeah,
second
yeah.
thing was, yeah, second thing Gina said that she came to fully understand the concept of quality improvement in 2 years. Same thing was with me. I attended number of training programs, attended matlab, after 2 years, around 2 years, then only we were able to teach others, mentor others. The concepts were a little bit clear for us. So it is not that people say that I have attended Poki workshop, I know quality improvement. It's not like that. Only when you do quality improvement projects, then only you will understand the small challenges, the little concepts which you will get clear through doing the projects. Not just attending a workshop, you are not a quality, you won't become a quality improvement improver, but though, yeah, you will have some understanding of what quality improvement is. But then you need to do projects after projects. If you do, then only you will fully understand the concepts of quality improvement science. Third thing is, Gina said that nurses should be involved in quality improvement because nurses are the larger workforce in the healthcare. With this, I would like to add, I always give this example that take a forest as a healthcare setup example, and we nurses have to look after whole of the forest, whereas other doctors or the physiotherapists or the dietitians, they will come and look after their own tree, and then they will go. But we as a nurses, we have to look after whole of the forest. I hope everyone will agree with this. So we have a very big responsibility, larger role to play while talking about the healthcare services. uh, Now, coming to a very prestigious award, a national award, the top award which we have in our country is Florence Nightingale Award for Nurses. Gina is very fortunate to be bestowed with this award, and I would like to know, Gina, in which year you were awarded this recognition, and a little bit of the basis on which you got it. And then also, for the audience, I would like you to tell them how to apply for Florence Nightingale Award. If they think that they have achieved something in their profession, then how to apply for this award, Gina?
Okay. So that was another story receiving this Florence Nightingale Award. I still remember it was on 1st January 2016. I was traveling to Kerala, and I was on board of an Indigo flight which was at 1:30 p.m. I came for morning duty just because everybody said that is the increment date, and you are not, because that year pay commission was getting implemented, right? Yeah. So everybody said you cannot take leave on that day. So I came for duty. I arranged a party for all the departmental party. So after having the party with HODs, doctors, nurses, uh, other workers in the ward, I went for airport from the Shivaji Stadium metro station to, I think T3 or T1. I don't remember it exactly now. My son was also with me. So we left home at 7:30 and went to hospital. He waited for me there, and we were running to the airport. And after getting into the plane, you know, we dozed off because it was 2 o'clock. Then there was an announcement. One passenger was suffering from severe breathing difficulty, but we don't know. In the announcement they were not mentioning that any, they were asking the for any doctor or a nurse in the flight, right? So they made 2 3 announcements. I was actually scared to say that I'm a nurse. I thought passengers, 200, among 200 passengers there would be one doctor. It's not possible that in that flight there is no doctor. So I waited for 2 3 announcement. Then my son told me, Mama, you are a nurse, you need to get up. And I was like shivering. Then went to the crew. then there was one suffering from severe
Yeah,
breathing
Gina, we lost
difficulty.
your voice. Can you
I
repeat after what your son said? Yeah, we lost your voice still.
yeah. I got up and went to the crew just to find
Okay.
out what is happening. I didn't know what is happening, why they are making continuous announcement for a doctor and a nurse. I went to the crew and I realized that an elderly passenger who would be more than 70 years of age was suffering from severe respiratory distress. His tears were rolling down. He was like, and I just counted his pulse. Then it was like 110, 120, 130. And I counted his respiration and I monitored the vitals. Then I thought something is really need intervention. So I asked for an oxygen because I'm not a doctor, I'm a nurse. I am not able to start any medication. I know the boundaries. Then I asked for oxygen. Then they handed over me a small cylinder which has only 5 liters of oxygen. I don't know how much, but that was a very small cylinder. Then they were not at all prepared to handle any emergency. Seeing the situation, I realized, but they had the oxygen cylinder and mask. So I started oxygen and I provided all the nursing interventions which I learned in the career and from my experience to that passenger, all non pharmacological interventions. In order to reduce the oxygen consumption, I got one blanket from some other passenger because it was 1st January, temperature inside was maintained, but still considering the age, I got a blanket eh, and provided all the nursing care which I can provide to him. Finally, what happened? The pulse came down, his pattern of respiration near normal, and that person slept for a while. So they made them to sit just beside that person, and my son was sitting alone on the seat. uh, when the situation managed so well, everybody was like, are you a doctor? Somebody asked me, are you a doctor? I said, no, I'm a nurse. Then the whole flight, now all the passengers were telling she's a nurse. I could listen that mm, words like she's a nurse, she's a nurse. Everybody was like uh, telling others she's a nurse, and that was one of the moment I felt so proud being a nurse, that too in the flight. So I came back from my leave. I was excited to explain narrate this event to my fellows. So during tea time, I told my friends that this happened, and everybody was just like, she's a nurse, and felt so proud of being a nurse that time. So after January, February, March, the INC, Indian Ministry of Health and Family Welfare, uh, announced the nominations for Nurses Award, Florence Nightingale Award. Then I applied, and bus, I just applied and I got that award. So that was all about award. Regarding criteria, I would say National Florence Nightingale Award has now been transferred to Indian Nursing Council by Ministry of Health and Family Welfare. And the nominations for the award is self nomination, and that will be scrutinized by a committee headed by senior officials like Honorable Justice Supreme Court. The final nominations are scrutinized by high level officers. It has now been reduced from 50 to 15 from this year onwards. And this award is being given to outstanding nursing personnel employed in central government, private institutions, ministry, missionaries, and voluntary organizations. This award consists of 50,000 rupees, a certificate, and a medal. Then the self nominations may also be forwarded after considering it in the state level. So the people from state need to forwarded it through the secretariat of their state body, state level body, right? And the state level committee will scrutinize your applications and forward it to the INC after if your application is fulfilling the laid down requirements, right? And the criteria mentioned in the INC mm, brochure is minimum 10 years of experience in the respective category, because there are three categories: nursing education category, clinical service, and nursing administration. So minimum 10 years of experience in the respective category. And in case of extraordinary performance, age may not be a constraint, right? That is also there. All nominations should reach through the Secretary, Health and Family Welfare of the concerned state, except for central government institutions. For institutions like central government, like ours, we can directly apply to the director, and our hospital has our own committee with doctors and nurses in it, and they will examine the all the applications and they will nominate three of the um, applications which are fulfilling the criteria, right? And the applications would include two photographs, your registration, your qualifications, and the agency has given me a certificate. MOHFW has given me a certificate, and they had sent 2 3 cookie boxes for me in my postal address after the incident. So that was the only paper with me when I applied for award.
Okay.
So yeah, that's all about.
Congratulations.
You can
Yeah,
visit inc.org.
yes, yes,
I think
yeah.
you can have more details on awards, criteria,
Hmm.
and
Hmm.
eligibility criteria.
Okay, Gina, congratulations again. This
Thank you
is a
so
big
much.
achievement. Actually, this is the topmost achievement which you can have as a nurse. So you have achieved that. Congratulations for that. And now again, you have been involved in this healthcare sector as an NQuas assessor. For the audience, NQuas assessor is okay, the role and responsibilities of a NQuas assessor. What is NQuas assessment? Gina, please highlight it, and then how it is contributing to you as a nurse being a NQuas assessor, how it is contributing to the nursing profession at large when you represent yourself as a like we used to discuss, when I go for assessment what happened, when you go for assessment what happened, we used to discuss, so these things in short, if you can tell people that how you are making difference for the nursing profession being an NQuas assessor, and how one can become NQuas assessor.
So, NCAS assessor training, I found is moving uh, all the groups. That was in the year 2019. I thought whether I am eligible for applying. This is a course which I am not aware at all. That was from NHSRC, National Health Resource Center. Even Dolma is a NCAS assessor. So I was not aware of this training and the scope of training. Uh, I was totally unaware of this NCAS program of Government of India. But being in quality, I thought, yes, there is a criteria. One is nurse, and other is quality, a word like quality. Then I applied for it. I motivated two, three friends of mine also. We can just apply because we are into quality and we are nurses. So let us apply. So finally, I got a mail from NHSRC that I am eligible for the training. So it was July 19 to 5 days training. Anyway, I don't remember the exact date, but it was in July 2019. That was a 5 days training in which they were we were trained for the accreditation program of public health facilities. You know, this was the first time that I learned about the quality accreditation program. We never think of quality, we never used to work like quality because the situation, the workload, the environment was such that we were not able to think of quality. We were never giving a ideal process. We were not providing care the way which we have learned. We have learned the nursing care for for a patient, but we were giving care to 3 to 4 patients on a single bed. So whenever we provided care, it was like not with quality. And I am here to learn about quality accreditation for government health facilities. Anyway, first day I found it, this is not going to work. But on fifth day I realized that yes, quality, for quality accreditation, I could relate with quality improvement. First we will do quality improvement, then quality accreditation for public health facilities. And there were checklists for this NCAS. NCAS is National Quality Assurance Standards, in which the government of India is asking us to perform as per the standards. All the public health hospitals up to district hospitals, right? Because you understand, the lowest level is health and wellness center, then primary health center, then district CHC, sorry, community health center, then district hospital, then comes the tertiary care center, that is medical colleges. So the checklist is not for medical colleges but up to district hospitals. So there are different customized checklist for health and wellness center, PHC, CHC, and district hospital. So, as I said, I got to know a lot of information about the public health system and at the community level. I would like to highlight that at the community level, I had only the experience of the medical colleges of Delhi, and I thought that all the medical colleges will be functioning in the similar way. But I was unaware of the other facilities like health and wellness center, PHC, CHC, and district hospital. That was interesting to understand the way they are functioning in the community level.
Gina, we are not able to hear you. I think Gina, there's some connection problem. So basically, Gina was, yeah, I think so. So basically, Gina was talking about how this NQuest assessment goes. Gina, are you back?
Yes,
You can just off the video and then talk
yeah.
because there's some.
Network issues, no?
Yes, yes, yes. So you can go ahead with your this. Yes.
So, my video is off now. So, I
Okay.
was telling that being into the NCAS assessment, I get to know more nurses, I get to interact with nurses working at the grassroots level. I can inspire them, I can teach them, I can learn from them. And that is the best experience I had during the assessments. And the nurses, when they know that the assessment team includes a nurse in it, they are super excited. I have seen nurses crying, saying, "Oh my God, ma'am, you are a nurse and you are here to assess us. It's a proud moment." So, like that, we have so many nurses in the assessment, and nurses are with NHSRC going to different states for assessment. So, me, Dolma, Jisha, there are so many nurses. Now, I think nurses are doing better assessment in these facilities. So, I would that is the best thing that Dolma asked me about NCAS assessments, because I this opportunity would be used to make others understand that there are so many arena which we need to explore. Nurses are the best healthcare providers during this time. We are getting the required visibility. The only requirement is you need to invest in terms of time, energy, and education. You have a lot of opportunities waiting out there. Yeah.
So, how can one become a NQuest assessor for our fellow nurses?
Okay. One should, the first criteria is you should have 40 years of age. Isn't
Mm.
it, Dolma?
Yes, 40 years of
Yes,
age.
it was there as one condition.
Mm.
Second is you should have master's degree,
And a BSc.
BSc nursing. Okay.
Yeah,
You can have a
any
uh,
graduate degree. Any graduate degree.
any graduate degree. Okay.
Yes.
Any
Mm.
graduate degree,
Mm.
and having experience as a nurse
Or
in the clinical or teaching anywhere, but you should have a
healthcare.
nursing experience. There are assessors from others. Mostly they are doctors. Assessors are doctors, Ayush doctors,
Even,
even
yeah, even I have met statisticians also.
yes,
So
and
it is, yeah, 10 years
BCom
experience
degree
in
with the
healthcare.
hospital administration. Have you
Mm.
seen MHA people attending and doing
Yes, yes.
assessments?
Yeah,
MHA.
we have
Ha, 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 ha.
MHA people also. The only criteria is 10 years experience in healthcare.
10 years
So these
experience. Yes.
three criteria, eligibility is 40 years and graduate, and then 10 years experience in healthcare. These are the
Correct.
mandatory experience, and then they give advertisement in NHSRC website. You can apply for it through proper channel, and then if you are selected, you can go for the training and then give exam. And if you get 70 percentage, you will be a impanel assessor for Government of India. है ना
But
यही है ना
these
गीता?
days, Dolma, you
Yes.
know, NHSRC is not advertising the this thing, NHS
Yeah.
trainings, because the
Okay.
state level nominator nurses, sorry, state level nominations are being considered for future trainings as of
And
now.
yeah, even recently, last year, they have trained only doctors, one batch. Before that, yeah, 19 में nurses का किया था.
हाँ, उसमें
Then
मैंने किया
now,
था.
yeah. Now they have trained only doctors batch one last year, and recently they have trained these Air Force people. I don't know. So maybe some collaboration with NHRC. So we have no idea about that. But then you can keep looking in NHRC website for any
Mm-hmm.
opportunity of such
Correct.
training. Not only
Mm-hmm.
assessor training, there are many training they provide. So you can be many. We have Bhavna here who has been mentoring, trainings. So likewise, there are many opportunities for nurses. If you see in the NHRC website, then you will know what are the opportunities and in which place you are interested in. हर किसी को हर चीज वो नहीं आता है. So like if you are interested in that position or that training, then you can apply for it. है ना?
Yes.
Yeah.
But
So not
never try
bad.
to
Yeah.
stay away from the bedside nursing. You should be with patients. That gives you
Yes.
a different confidence, you know, for the nurses. Huh?
And the
Yes.
essence of nursing is bedside care. So if
Yes.
you, even if you are teacher, try to be more into, clinical, the student mentoring and all. the more you are into clinical with the student, a better teacher you will become. So we have teachers here in this platform also. So for those, I would like to request you to be maximum time, we like as per your schedule, जब भी आपको मौका मिलता है, please try to be in the clinical with your students so that you will also improve as a teacher. So for our
Yes,
clinical nurses, yeah, I would request be proud to be at the bedside, and with your bedside practice, you can do many, many, many more things. The only thing, as Gina said, you need to invest in knowledge, you need to invest in time, you need to invest in your
education,
energy.
your
Energy,
qualifications.
yes. अभी एनर्जी की बात किया तो just yesterday we spoke, we discussed what is the biggest challenge for you as a assessor, NQAS assessor.
Okay, biggest challenge is traveling 300 kilometers, 400 kilometers by road is, I don't take it as a challenge, but reaching there, the public hospitals, the way they are working, the quality of care, the
Gina, we lost you again. I think network issue. आगे जब हाँ.
similar way, all the nursing process, if you look into the infection control practices, we nurses are not aware of the correct practice of infection control. For example, in my hospital, if I get into that, it will take another 1 hour.
हाँ,
So
तो
let
शॉर्ट में बता दो, शॉर्ट में बता दो, जस्ट समराइज.
because every time, that is very popular in our hospital, because we tried to uh, improve the uh, practice of that recapping the cannula. I don't know how many of you are making it correctly. The cannula caps are being given to patients' relatives in our hospital to a container. But the ideal process is every time need to have a cannula cap, a fresh one that needs to be come in blister packets, so that during disconnection of an IV fluid, you need to cover that tip and cover the cannula also. But what we do is we are covering that IV cannula with the unsterile, infected, or contaminated cannula caps. Because for every cannula, there is a single cap. We used to reuse it many times. But the ideal process is you need to have a every time you need to have a fresh one. So this QI project took me 5 years to get our hospital new cannula caps. During this session, I am not able to make you understand it fully, but I present it in different platforms how we got it. But the dolma, I would say the biggest challenge is nursing processes are not ideal. As a result, we are not able to give them full compliance, and they think they are doing the right thing, and we think it is not the ideal. And the time taken for convincing them that this is not the correct way, we can have, because we are at par with them only. We are not going as a supervising or judging authority. We are only there to find facts, or every time we are telling them that we are here to find the facts and help you to become or improving the processes you are carrying out. That is the challenge I see. Sometimes they expect more, and we are not able to give them the desired scores.
Mm-hmm.
So that is the biggest challenge in NCAS, and I am so happy that Government of India has started this initiative, so that we are answerable for somebody is seeing our processes. Till now, we are doing, everybody is coming, going, but nobody is there to see what we are doing and how we are doing. But this is good
Yeah.
that somebody is seeing and watching our work.
And yeah, we were discussing yesterday also that when there is some NQuas assessment, the facility gives so much importance to the nurses, and the nurses are the driving force for this certification. So recently, my last visit also, they were all dependent on one nurse. You know, when we were asking for something, they will ask, I can name her here. So she is Kavita, and in that facility, अगर कुछ पेपर चाहिए, कविता वो कहाँ है, कविता कविता कविता. So they appreciate her a lot in the meeting also, that she's a BSc graduate nurse and working in a district hospital. So uh, there are many nurses who are doing really great. So the point Gina has put out is that people are really working hard and they expect very high marks, but then they lack mentoring. So that's why they were doing wrong things so dedicatedly. They think that they are
Yeah,
doing right.
yeah,
Yeah.
yeah.
So that is the main challenge we